Hello everyone, I am Dr.B.Archana, a homeopathy doctor from India. I welcome all of you to the World GNM Day celebration. Today, May 17th, 2022 is the 87th birthday of Dr. Hamer, the founder of the revolutionary science called German New Medicine. We, the global GNM family, headed by Dr.C.J.Varghese, has taken initiation to celebrate Dr. Hamer's birthday as World GNM Day. To pay tribute to the noble soul, the German New Medicine speakers across the globe has gathered in this platform. I take this golden opportunity to pay my tributes to Dr. Hamer through this presentation. I am Dr.B.Archana, homeopathy doctor from Chennai, Tamil Nadu, India. I did my DHMS degree from Venkateshwara Homeopathic Medical College, Porur, from 2001 to 2007. I am practicing homeopathy in Chennai since 2014. I took training from Dr. Praful sir in predictive homeopathy at Mumbai in 2007 and 2017. I came to know about Dr. Hamer's science through Dr. Praful sir during my SCPH in 2017 at Mumbai. I became a part of predictive homeopathy doctors, and from there I came to know Dr. C.J. Varghese sir. Being a homeopath, it was very easy for me to learn German New Medicine as a basic philosophy of both the sciences complement each other. Since 2017, I am trying to apply my German New Medicine knowledge in each and every case coming to my clinic. I educate my patients with the basic knowledge of GNM and help them break the myths prevailing among the public. It gives immense happiness to speak the truth and make them understand the real nature of the so-called diseases. I became a part of Dr. C.J. Varghese's GNM India movement in 2017. I am with Sir for the past 5 years, being a part of the movement, being a co-admin of Sir's 17 plus 3 WhatsApp groups, managing the groups and rendering help to the members to learn GNM. My videos are published in our website www.globalgnm.com. I have translated few of Dr. Hamer's work in Tamil. My YouTube channel, Dynamic Homeocure, is exclusively providing GNM knowledge to the Tamil-speaking community. Today I will be presenting the second biological natural law of German New Medicine, the knowledge of disease. We all know that Dr. Hamer, the founder of German New Medicine, has formulated the 5 biological laws which form the base of German New Medicine. Gratitudes to our Guru, Dr. Praful sir, from whom I came to know about Dr. Hamer's science. Not only me, many Indian homeopaths and predictive homeopathy followers across the world apply Dr. Hamer's science in their day-to-day practice because of Dr. Praful sir only. Gratitudes to my GNM mentor, Dr. C.J. Varghese sir. In spite of the hardships Dr. Varghese sir faced, he never quit the mission of spreading the science of Dr. Hamer, not only in India but worldwide. His genuine, persistent, selfless efforts to spread GNM itself is an inspiration to many young people like me who choose to learn GNM sincerely. His noble mission is growing day by day with his persistent efforts, and the ultimate evolution is that the GNM India evolving into global GNM. Today, the World GNM Day celebration is also a brainchild of Dr. C.J. Varghese sir. He is a driving vital force of the show. It is a hallmark in the history of German New Medicine to celebrate Dr. Hamer's birthday as World GNM Day. Disclaimer: the information given in this presentation is for educational purpose only. It is not intended to be a substitute for professional medical service. Participants shall consult their medical doctors for health reasons before using anything that is disclosed during the course of this presentation. Students shall not use any of the different information given in this presentation while writing their examinations. How do we decide that we are sick or diseased? It is through the internal symptoms experienced solely by the patient or through the external signs found by the patient and the people around him like swellings, redness, rashes, etc. through blood parameters, urine and stool reports, urine and stool culture, biopsies, through radiological reports like X-rays, ultrasonograph, MRI, CT, and invasive procedures like angiogram. And apart from all these, when we go for a routine health checkup or master health checkup, or when we go for getting a physical fitness certificate from a physician for insurance purposes, we get to know that we are sick and diseased. Who are all involved in assessing our health and diseases? It is obviously the patient, then the doctors, lab technicians, radiologists, pathologists, sonologists, microbiologists, health insurance companies, and life insurance companies. So who are all involved in assessing our health and disease related things around us? Doctors and hospitals, hospital products manufacturers, pharmacy, vaccination manufacturers and suppliers, paramedical services like labs and scan centers, therapies and yogas, medical colleges, institutions giving training to them, diet, supplement, gym, immunity enhancements, life and health insurance, indirect businesses like hotels, transportation, service apartments, organic products, skin care, oral care, hair care, to avoid infections, toothpaste, soap, sanitizers, toilet cleaners, surface cleaners, antibacterial, antimicrobial, beauty products, nail products, breast enhancement products, sunscreen lotions, health drinks, whatnot. Can you see that the world is revolving around you? These many people and industries are involved. So, how much do you know about yourself, your body, and your health? It's the topic of the day. Any symptoms or signs or deviations in the lab reports or radiological or sonological findings makes us panicky. Many a times the so-called healthy individuals turn out to be patients and sick after the routine health checkups. Why are we panicked when we have symptoms or signs or any deviations in the test reports? Why are we afraid of the names of the diseases? It is because of the lack of knowledge about the so-called diseases. Hence, today's topic is a need of the hour as it provides the right understanding and knowledge about disease. Knowledge is power. Knowledge about disease helps us to be free from panic of diseases. Dr. C.J.Varghese gives the example of when we enter a dark room, if something long and thick falls on us, we immediately assume it to be a snake and get frightened. But on switching on the light, if it is found to be a rope, we feel relieved. In the same way, until we are ignorant about the disease process, we will be panicky and fearful. So, fear comes with the lack of knowledge. Power to overcome fear comes through acquiring right knowledge. We have plenty of information available around us. Which is the right one? How to find the right one? Testing them on yourself and verifying is the best way to find the right one. So, what are all the things we must know to have the complete knowledge about the disease? What is disease? Why are we diseased? How to manage our diseases? Is falling sick inevitable or can we prevent these diseases? Who decides your health? WHO decides your health. What is health? Definition given by WHO is that health is a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity. Other definitions given by other Britannica and Wikipedia are disease is any harmful deviation from the normal structural or functional state of an organism, generally associated with certain signs and symptoms and differing in nature from physical injury. This is a definition given by Britannica. So, what is the definition given by Wikipedia is a disease is a particular abnormal condition that negatively affects the structure or function of all or part of an organism and that is not due to any immediate external injury. Diseases are often known to be medical conditions that are associated with specific signs and symptoms. Dr. Hamer gives us the right knowledge about the so-called diseases. Are they harmful, abnormal, and negative? But GNM calls them as Significant Biological Special Program, SPS, which are meaningful and has a biological purpose and applicable to all living beings. Why? So for those who are new to GNM, I will brief the first biological law, as all the 5 biological laws are interlinked and it is important to read them in order and deeply and thoroughly. So first biological law is every disease or SBS originates from a DHS or conflict shock, which is unexpected, sudden and specific, that occurs simultaneously in the psyche, the brain and the corresponding organ. So a conflict shock or DHS affects the psyche, the brain and the body simultaneously to produce the so-called diseases, and it is called as SBS in German New Medicine. So this is a picture I created by myself to make you understand the connection between the psyche, brain and the body. Psyche means it is a subconscious mind which is influenced by the DHS, and it produces physical symptoms on the body level through the mediator called brain. So psyche, brain and body, though we read them as separate entities, they are all one and same. They are all one and the same. So of Dr. Hamer, the differentiation between the psyche, the brain and the body is purely academic. In reality, they are one. So DHS or conflict shock or biological conflict is unexpected, sudden and emotionally traumatic incident. It precedes the physical symptoms and it happens on the subconscious level. DHS affects the psyche, the brain and the body. So DHS means nothing but Dirk-Hamer syndrome. Dr. Hamer named it as Dirk-Hamer syndrome. It is usually called as conflict shock. Conflict shock is nothing but an emotionally traumatic event which is totally unexpected and sudden. So which affects the body, mind and the brain at the same time. So on the psyche level, it is a conflict theme, and on the brain level, it is a Hamer focus, and on the physical level, it is a physical signs and symptoms. DHS affects the psyche, brain and body simultaneously. The whole program is called as SBS in German New Medicine, as it has a purpose of helping the individual to cope up with the emotional trauma. It has a meaning, purpose, and it is not abnormal or negative or harmful as we are taught so far. I request all the audience to explore our www.globalgnm.com website for complete understanding of the first biological law. If you see any symptoms or sign on the physical level, there must be some specific conflict that has occurred on the psyche level and on the brain level. Physical manifestations are the reflection of the mind. Body cannot lie. Some exceptions are poisoning, injury, and severe malnutrition. Poisoning, injury, and severe malnutrition can cause organ malfunctioning without a DHS. So we need to unlearn to relearn the new paradigm with our recent gifted mind. Education is what remains after one has forgotten what one has learned in school, says Albert Einstein. So what is disease? What is not at ease? The body? Is it abnormal, harmful, negative? See this picture. This picture is looking abnormal and weird, right? But this is the right way to see the picture. Are we still viewing it wrongly? Disorder and negative. Do you say that the stick in the row that has come down is disorderly and negative? Or it has a purpose of saving the other sticks behind it? This tree is looking abnormal and negative, right? But it has a purpose. It has shed the leaves to save the tree, to conserve the water for preserving the life of the tree. Likewise, the diseases we are facing in our day-to-day life has a purpose. Let's see some conflicts, SBS and their biological purposes. In lung cancer, for example, the extra cells improve the capacity of the lungs in response to a death-flight conflict. In colon cancer, they increase the production of digestive juices to be better able to manage an indigestible morsel conflict. In breast cancer, the additional milk producing cells allow a female to produce more milk for a sick offspring in the event of a nest worry conflict. In prostate cancer, the extra cells increase the amount of semen in order to enhance the chance of impregnating a female once a sexual mate becomes available. This happens with a DHS called procreation conflict. In case of females, the same procreation conflict will impact the uterus, and in case of uterine cancer, the increase in the cell to thicken the uterus mucosa is to aid the implantation of fertilized ovum. In GNM, we call all the so-called diseases as SBS, Significant Biological Special Program. So what is not at ease? The psyche. What is the right perception of disease? They are significant biological special programs designed to save our psyche. The purpose of the program is to translate the conflict shock to physical symptoms, to free the psyche, and to improve the function of the organ. So from now onwards, we will call all so-called diseases as SBS, Significant Biological Special Program. So from this understanding, all the so-called diseases becomes meaningful biological survival programs every human being is born with. Scary cancers, deadly diseases, terminal illnesses lose their frightening image and understood as the phases of the SBS to ease the distress on the psyche level. So Dr. Hamer says all so-called diseases have a special biological meaning, while we used to regard Mother Nature as fallible and had the audacity to believe that she constantly made mistakes and caused breakdowns, malignant, senseless, degenerative, cancerous growths, etc. We can now see as the scales fall from our eyes that it is our ignorance and pride that were and are the only foolishness in our cosmos. Blinded, we brought upon ourselves this senseless, soulless, and brutal medicine. Full of wonder, we can now understand for the first time that nature is orderly and that every occurrence in nature is meaningful. Even in the framework of the whole, nothing in nature is meaningless, malignant, or diseased. So Dr. Hamer gives the right knowledge about the so-called diseases. So this is the second biological natural law of German New Medicine. Every disease, that is SBS, runs in two phases provided there is a resolution of the conflict. Few terms to be learned before learning the second law: normotonia, sympathicotonia, vagotonia. Normotonia, sympathicotonia, vagotonia are all related to autonomic nervous system. So what is autonomic nervous system? It consists of sympathetic and parasympathetic system. They are opposite to each other in their functions. You can see from the slide, sympathetic system dilates the pupil, parasympathetic system constricts the pupil. Sympathetic system inhibits salivation and parasympathetic system stimulates saliva flow. So sympathetic system relaxes bronchi and parasympathetic constricts bronchi. Sympathetic system accelerates heartbeat and parasympathetic slows heartbeat. So these are all functioning in the opposite way. So from the picture, you can also understand that the respiration, digestion, excretion, sweating, heartbeat, blood vessels constriction and relaxation are all controlled by autonomic nervous system. Let us try to understand the terms normotonia, sympathicotonia, and vagotonia. Normotonia indicates a balanced day-night rhythm where sympathicotonia alternates with vagotonia. So what is sympathicotonia? It is the day mode, that is the state of stress. Fight or take a flight mode. It extends from morning 4 a.m. to 8 p.m. So this is called as sympathicotonia. So what is vagotonia is? It is a sleep mode. That is a state of rest and digest mode. It extends from night 8 p.m. to next day morning 4 a.m. So if you are waking at 4 a.m., having good appetite, thirst, all your excretion processes are regular, digestion is good, you are sleeping peacefully, then you are in normotonia state. So the change of vegetative system, that is the day and night rhythm alteration, respiration, digestion, excretion, sweating, heartbeat, blood vessel constriction and relaxation alteration, these are all help us to understand whether the person is in a conflict active phase or he is in a healing phase. This is the diagnostic criteria in German New Medicine. So this is the groundbreaking discovery by Dr. Hamer, which every individual must know, and this is the right knowledge of disease. So the two phase of every SBS is conflict active phase and the healing phase. So conflict active phase proceeds to healing phase only if conflictolysis takes place. And healing phase has two more components in it, that is the PCL-A and PCL-B. PCL-B happens only if epileptic crisis takes place. Let's see about the conflict active phase. It is hardly manifested or felt by the patient. This is the phase where the patient is asymptomatic and the health checkups and routine tests show some findings during this conflict active phase only. So the DHS alters the day and night rhythm. The autonomic nervous system switches to lasting sympathicotonia, that is a prolonged state of stress. Manifestations of conflict active phase are nervous restlessness, fast heartbeat, elevated blood pressure, slow digestion, frequent urination, little appetite. So during stress, blood vessels constrict. Please do remember that sympathicotonia is a state of stress. So when the DHS impacts a person, the person is in conflict active mode, which is a lasting stress state or the prolonged sympathicotonia state. So during stress, blood vessels constrict, cold hands, cold, sweat, shivers or manifested. So we call conflict active phase also as cold phase. This is the reason why I have given blue color for all the slides. So the conflict active phase, during the conflict active phase, the psyche is in a compulsive thinking mode. Constant thinking about the conflict leads to sleep disturbances. Waking up shortly after sleep, usually around 3 o'clock in the morning. The purpose of extra waking hours and constant dwelling on the conflict or to find a resolution to the conflict at the earliest. So when I show the slide, I request all the audience to compare your life situation where you encountered some unexpected emotional trauma and had such manifestations on your body so that you can relate with your complaints easily and you can understand the two phases of the SBS and you can understand the second law easily. So who decides that we are sick or diseased? It is none other than the patient. That is the individual who has encountered the DHS. It is me. Not the reports, not the lab findings. How do we decide that we are sick or diseased? It is through the nervous restlessness, fast heartbeat, increased blood pressure, slow digestion, frequent urination, poor appetite, cold hands, cold sweats, shivers, sleep disturbances. Most of the time we see patients coming to our clinic for sleep disturbances, increased blood pressure and slow digestion. But they do not know that it is all not a separate disease in itself, but they are the manifestations that they are still conflict active. So I heard through Dr. C.J. Varghese sir that when some person comes to Dr.Hamer, he used to touch their hands and see whether they are cold. So cold hands is an indication that the patient is still conflict active. So what do these symptoms imply? Simply it implies that the person is in conflict active state. So increased blood pressure, cold hands, frequent urination, slow digestions are nothing to worry, but it is a manifestation that the person is in conflict active mode. In the conflict active phase, the sharp ring configuration of Hamer focus is seen in the brain relay corresponding to the specific conflict. DHS slightly damages the neurons within the specific brain relay. These are all the brain level changes during conflict active phase. So on the organ level, physical changes that serve the biological purpose to improve the function of the organ so that the individual is in a better position to cope with the conflict. So first we have seen about the conflict active phase. Next we are supposed to read the conflictolysis, but before going to conflictolysis, I would like to share about this hanging conflict. So what is hanging conflict? After the conflict active phase, only if conflictolysis happens, the healing happens naturally. A conflict which cannot be resolved remains constantly in a conflict active phase, and this is called as hanging conflict in German New Medicine. So a hanging conflict refers to the situation where a person remains in the conflict active phase because the conflict cannot or has not been resolved. Many of us are living with hanging conflicts with little or no symptoms, since symptoms in the conflict active phase are rare. Lasting intense conflict activity, however, drains the body of energy, which could lead to death. So in our day-to-day practices, we see patients asking us, why are you inquiring so much in detail about our life situations? No doctor asked me these details. Is it truly important? I am fine with other modalities of treatments where such interrogations are not done. They are not killing me. I am still running the show. So this shows the ignorance of the patient. So it is very important to understand the conflict they have encountered. If they are not understanding the conflictolysis is not possible, and the patient continue to be in hanging conflict forever. So if the conflictolysis happens only, healing phase happens naturally. So the most important and crucial part in the SPS is the conflictolysis. So let's try to understand it. Only if conflictolysis happens, the person will go on to the healing phase. Otherwise, he remains in the conflict active phase forever and live with hanging conflict. Conflictolysis is the U-turn in the SPS. You turn into yourself and make an inward journey to evolve personally. This self-assessment and self-awareness is the key to heal yourself. And this is what is emphasized in every religion and moral teachings, right? This U-turn is very essential to turn the altered vegetative rhythm to normalcy. Dr. Hamer says we have to resolve our conflicts twice. First in real terms, then spiritually. So only if we know the sources of conflict, we can be in a better position to resolve the conflicts. So let's see what are all the sources of conflicts. First of all, conflicts can be real or imaginary or figurative also. So from which areas and all we can expect conflicts means relationship issues within family, that is with spouse, children, parents, etc. Relationship issues outside the family, colleagues, friends, classmates, higher authorities. Social issues, financial issues, work related, that is performance, recognition, humiliations, school or institution related humiliations, performance, worries about self, survival needs, loss or any separations. These are all the sources of conflict. So let's see some techniques for conflictolysis. A sufficient knowledge of German new medicine is essential for assessing the situation. So conflictolysis. In Greek, lysis means loosening, dissolving, setting free or release. So loosening, dissolving, setting free or releasing the conflict is what is called as conflictolysis. So practical solutions can be given for real conflicts, and conflicts can be resolved, or if the conflict is very intense and it cannot be resolved, means we have to go for a downgrading of conflict. And in certain cases, we should not resolve certain conflicts. This knowledge of resolving or not to resolve or to downgrade or to give only practical solution comes with the deeper knowledge of German new medicine and with experience only. So conflictolysis through self-analysis. The U-turn, base of spirituality and German new medicine therapy. This is a source of healing. This is the one and only source of healing. So what all can be done to resolve conflicts? So we need to reconsider our attitudes, our understandings and our sensitivities. So seeing the larger picture, letting go of anger, viewing from a different angle, walking in the shoes of others and understanding others' perspectives, practicing and forgiving and loving kindness. These are all the ways to resolve conflicts. Conflictolysis sometimes happens when life circumstances change or when other matters gain more priority. Say, for example, if our conflict is due to a colleague or classmate or neighbor, a change of job, school, or house, respectively, will naturally resolve the conflict. Many conflicts happen in our early stages of life, like disappointment, separations, loss of loved ones, etc., are resolved with time as we grow older and connect with different people and face different life situations. So time heals certain conflicts automatically. So GNM therapy, in most of the cases, GNM therapy is targeted at giving the knowledge of GNM and helping the individual to identify its conflict and resolve them. Remember, GNM is not another medical system or alternative system of medicine. It is the base of all medical studies and systems, and it is a basic understanding of man and his disease process. GNM does not give any material medicine. Instead, it gives the right understanding and knowledge about the disease to evaluate oneself. So the first step in German new medicine therapy, as well as in the conflictolysis, is to provide the knowledge of German new medicine and to create self-awareness and rectify the interpersonal relationship issues. This presentation is also aimed at providing German new medicine, the first step to resolve your conflicts and to assess yourself and the so-called diseases you have encountered so far. So German new medicine is called as La Medicina Sacrada in Spanish language, the sacred medicine. So it is the knowledge of German new medicine and self-awareness which is given during German new medicine therapy. Why is this knowledge of GNM and self-awareness so important, you may ask me? Because DHS happens in the psyche at the subconscious level. So it is imperative to rewrite our faulty, defective data written on the subconscious mind. This rewriting is possible only through GNM knowledge. Why should I learn GNM? What is the need for the introspection? So lessons in life will be repeated until they are learned. This is a very famous quote, and this is why we need to learn GNM. So if you are not aware of your conflicts, you will be in hanging conflict, or you will not be resolving your conflicts and you will be in hanging healing only. So need for GNM knowledge is that it helps the person to backtrack his conflicts and understand his sensitivities and reconsider his attitudes and rethink about his understandings. And GNM knowledge helps us to understand that conflicts are the sole sole cause for all our ailments. It helps us to welcome the healing symptoms and it helps us for a freedom from fear of disease. And the self-awareness created helps us to rewrite our subconscious reading. Learning and relearning the new paradigm is a need of the hour and it helps us to be in a better position to cope up in future in similar situations. So now about the healing phase. So we saw about the conflict active phase and the conflictolysis, and in between we saw about the hanging conflict also. Now we will be seeing the healing phase. So healing phase is called as post-conflictolysis. So it is mentioned as PCL, post-conflictolysis. So now the conflict is lysed and healing has taken place. Now the autonomic nervous system switches to a lasting vagotonia, that is a prolonged state of rest. We already saw that vagotonia means it is a state of rest, that is a sleep mode or rest and digest mode. So manifestations of healing phase are fatigue with good appetite. Though we are very tired and weak, we have a good appetite during healing phase. Resting and the desire to eat provides required energy for healing. Strong need for day sleep, slow pulse, low blood pressure are manifestations of healing phase. So when we have slow pulse or low blood pressure, don't worry about it. It is all healing phase only. So during vagotonia, blood vessels expand, leading to warm hands and warm skin. So we call healing phase as warm phase. This is the reason why I have given red color for all the healing phase slides. So during the healing phase, the psyche is in a state of relief. If the healing phase is intense, that is when the conflict is intense and the healing phase is also intense, the tiredness could be so overwhelming that one can hardly get out of the bed. So healing phase must be studied under the following headings. First part of the healing, that is the PCLA exudation phase. Then the epileptoid crisis, that is a brief reactivation of the conflict active phase, which proceeds to second part of the healing, PCLB scarification phase. So the first part of healing phase, PCLA, exudation phase manifestations are an edema or swelling at the healing area to protect the healing area, increased blood flow to the healing tissue, leading to fever and inflammations, expelling of the byproducts of the cell removal process leads to discharges, healing of epithelial tissues such as skin leads to itching, healing assisted by fungi and TB bacteria leads to night sweats, swelling and inflammation causes severe pain, the syndrome increases the swelling. So let's see what is a syndrome. The syndrome is nothing but the kidney collecting tubule syndrome. So this kidney collecting tubule program is activated when we encounter an active abandonment conflict or an existence conflict, or after any biological special program during the healing phase, this syndrome is activated. When the organism withholds water, the excess fluid is also stored in the healing organ and in the correlating brain relay. So abandonment conflict is nothing but a fish out of water situation. Existent conflict, you can any report is showing any deviation means you will be having whether I will be alive. So whether I will be living normally. So whether my life is at stake. So life is at stake situation is called as existent conflict. This existent conflict comes along with all the special biological programs. That is why this syndrome is activated with every biological special program in the healing phase. So the size of the edema in PCLA, that is the exudation phase, is decided by the three things: the magnitude of the conflict, intensity of the preceding conflict active phase, and the degree of water retention due to an active abandonment or existent conflict associated with the real conflict. So a diagnosis shock, the fear associated with the disease and hospitalization all will instantly activate the syndrome. Hence, resolving the kidney tubules related conflict must have absolute priority. The resolution of the existent conflict initiates the instant release of remained water. So once the existence conflict is resolved, the retained or the withhold water will be released instantly as in urinary phase. With this effect, all the swellings go down, and this can be life-saving. So Dr. Hamer has given few tips to manage the syndrome. The support and care of family and friends, the reassurance to be looked after in an environment free of fear is of immeasurable therapeutic value. So it is the existence conflict or the abandonment conflict that is instantly activating the syndrome. So care and support from the family and a reassuring situation resolves the abandonment and existent conflict. So if the conflict cannot be resolved at the time, Dr. Hamer recommends salt bath with a salt concentration of 0.9%. 1 kg of salt to 99 liters of water in order to address the fish out of water situation on a solely biological level. By taking the organism home to the sea, the body is able to eliminate large amounts of urine. In addition, isotonic salt baths balance the salt content of blood serum, which decreases during the healing phase of the kidney tubules due to the protein loss. These are all few tips we get by learning German new medicine to manage the swellings and the water retention in the body. Even obesity is nothing but the water retention only. So we must know certain clinical tips given by Dr. Hamer to manage our patients efficiently. It's obvious that syndrome means withholding of water. So syndrome increases the swelling in the healing area. So manifestations on the brain level during the PCLA phase, exudation phase or PCLA phase. So exudation means oozing out or seeped out. So it is all about the fluid retention. So on the brain level, the brain edema causes dizziness and headache. PCLA headaches are dull pressure headaches. So in general, brain edema is nothing to worry about. A big swelling caused by water retention or multiple brain edemas, as in case of syndrome, causes strong pressure, and this may lead to coma and death. This is what happens during sudden infant death syndrome. This growing brain edema is usually diagnosed as brain tumor. Complications do not arise from high fever, but due to a large brain edema. So do's and don'ts during healing phase. This is a very essential knowledge, once again given by German New Medicine Understanding only. So ice pack on the head or cold showers during healing phase helps the person to bring down the edema in the brain level. Stabbing headaches do not respond to ice packs because there is no edema. When lying in bed, the individual is asked to lie with the head elevated so that the brain pressure is released. And the individual is instructed to restrict the fluid intake so that the fluid intake will not be increasing the swelling. And the individual must be requested not to expose himself to direct sunlight on the head and not to take sauna bath or any hot baths during healing phase. During the first part of the healing phase, that is a PCLA, water and serous fluid are drawn to the area, creating a brain edema to protect the brain tissues during that period. brain level changes. These are all the brain level changes during PCLA phase. So organ level changes. During the healing phase, the affected organ is restored to its normal function. Manifestations after epileptoid crisis are sharp stabbing headaches happen after epileptoid crisis. The brain edema has been expelled and the mechanical pulling of the meninges is felt as sharp pain. This is called as migraine headaches. Migraine headaches start in the healing phase of premotor sensory cortex conflicts and are most intense during the epileptoid crisis. After epileptoid crisis is over, the PCLB phase, that is the second part of the healing or the scarification phase, starts. Fibroblasts in the connective tissue in the healing area produces collagen. Collagen produces scarring. So at the end of the SPS, the original function of the organ is restored and the day-night rhythm returns to normotonia. So brain edema is pressed out and the glial cells proliferate at the site to finish the healing process on the cerebral level during the healing phase. So glial cells, unlike the nerve cells, have the ability to multiply. So they proliferate at the healing site and they help in preserving the cerebral level functionings. The function of the neuroglia is to repair brain damage. So DHS affects the brain relay and that brain relay is restored to normalcy by the glial cell proliferation. Intense conflict activity and brain edema in the PCLA phase leads to stretching of the synapses and this forms an insulation around the neurons. During the healing phase, the glial cells melt the neural sheath with this insulation layer. This repair work is crucial to ensure a normal functioning of the organ that is controlled from that brain relay. So in conventional medicine, the natural buildup of neuroglia is wrongly believed to be a brain tumor termed as glioma, glioblastoma or astrocytoma, referring to the star-shaped form of the glial cells. The classification of brain tumors grade 1 to 4 is based on the intensity of glial cells. Grade 4 is considered the most aggressive with the propensity to spread throughout the brain. If more than one tumor is found in the brain, the diagnosis reads as multiple brain metastases. These are all frightening diagnostic names, which becomes very easy to understand when we read the healing phase of the SBS with the knowledge of German new medicine. So Dr. Hamer demonstrated already in the early 1980s that so-called brain tumors are not cancers, but instead an indication that a natural healing process is taking place in the brain parallel to the healing on the corresponding organ. Symptoms on the related organ might not be noticed, particularly if there is no water retention, which would increase the swelling causing pain. In German new medicine, a brain edema and a brain tumor is nothing but Hamer focus in different phases of biological special programs. So do we need to worry about these symptoms? Fatigue with good appetite, resting and the desire to eat, strong need for day sleep, slow pulse, low blood pressure, warm hands, warm skin, edema, swelling at the affected area, fever, inflammation, discharges, itching, night sweats, severe pain, dizziness and headaches, dull pressure headaches, sharp stabbing headaches, profuse urination, migraine headaches, scarring. What do these imply? These are nothing but healing phase symptoms. So let us welcome them without panic. So points to be noted in the second law. Organs that undergo cell proliferation in conflict active phase are necrotized during healing phase if conflictolysis happens. Organs that undergo cell loss in the conflict active phase are reconstructed during healing phase if conflictolysis happens. The cell proliferation or the cell necrosis during conflict active phase has the biological purpose to ease the psyche from the distress. In the healing phase, the affected organ is restored to its normal functioning. The next question in your mind would be, which organ will undergo cell proliferation during conflict active phase? Which organ will undergo cell loss during conflict active phase? The third biological natural law of German new medicine gives the answer. The next question in your mind would be, how will the proliferated cells undergo cell loss in healing phase? How will the necrotized cells undergo cell proliferation in healing phase? The fourth biological natural law of German new medicine gives the answer. So I have made this slide to brief the third and fourth biological natural law of German new medicine. So brain relay, germinal layer, conflict active phase, healing phase, assisting microbe. Under these heads, we can understand the outline of the third and fourth biological law. So brainstem controlled organs, that is the endoderm derived tissues, undergo cell proliferation during conflict active phase, and during healing phase, the proliferated cells are necrotized with the help of mycobacteria, TB and fungi. So cerebellum controlled old mesoderm derived tissues also undergo cell proliferation during conflict active phase, and they undergo cell loss with the help of bacteria, TB bacteria especially. So cerebral medulla controlled tissues, that is the new mesoderm derived tissues, undergo cell loss during conflict active phase, and the cell loss is compensated or cell construction happens in the healing phase with the help of TB bacteria. In case of cerebral medulla controlled new mesoderm derivative tissues. So cerebral cortex controlled ectodermal derived tissues and organs also undergo cell loss during conflict active phase, and this cell loss is compensated by the cell proliferation taking place in the healing phase with the help of the so-called viruses. Dr. Hamer says, if they exist. The skeletal muscles, islet cells of pancreas, alpha islet cells and beta islet cells, inner ear cochlea and vestibular organ, retina and vitreous body of the eyes, and the olfactory nerves belong to the group of organs that respond to the related conflict with functional loss or hyperfunction. These things alone will not be undergoing cell proliferation or cell loss, but they will be undergoing functional loss or hyperfunction during the conflict active and healing phases. So Dr. Hamer gives us the right knowledge about the so-called diseases. Intense conflict means intense cell proliferation during conflict active or healing phase. Intense conflict active phase means intense healing. So intensity of the conflict and size of the Hamer focus decides the extent of the edema. So Dr. Hamer says in German new medicine, there is no malignancy, there is no benign or malignant, just like there is no benign or malignant in the biology. So when you have tumors, you have to think whether it is which organ is affected, whether it is the conflict active phase or it is the healing phase. So when you have bacterial or fungal or any other infections, you have to say whether it is because you are proceeding from the conflict active to healing phase. So when you have ulcers or any tissue loss or any bleeding, you have to understand which organ is affected, whether it is because of the conflict active phase or because of the healing phase. This understanding helps us to come out of the panic state to the calm and freedom from fear of disease state. So now we will be seeing about the epileptic crisis. So we already see about the exudation phase and the scarification phase. Now we will be seeing about the epileptic crisis. So epileptic crisis is a very important topic. So I have taken it as the last, but this is the order of healing. That is, the first is the exudation phase, then is the epileptic crisis. Only after the epileptic crisis taken place, scarification takes place. But because of the importance of epileptic crisis, I am talking about this in a later way. So epileptic crisis is nothing but the height of the healing, and it is a brief reactivation of CA phase. The epileptic crisis is a significant biological counter-regulation mechanism. The organism or the individual is pulled out of the vagotonia and the individual is in a conflict active phase or a state of stress for a brief period. Again, restlessness, nausea, elevated blood pressure, a raised pulse, cold sweat and shivers will be manifested during epileptic crisis. So epileptic crisis also takes place on the three levels, the psyche, the brain and the body. The biological purpose of the sympathicotonia surge is to expel the edema that developed both on the organ and in the correlating brain relay. The expelling of the brain edema is particularly vital as it relieves the brain pressure. The epicrisis is followed by a urinary phase in which the body eliminates all the excess fluids. This we already saw while talking about the syndrome. If the edema cannot be completely expelled because of the syndrome or due to conflict relapses, the residual edema remains until the biological special program is completed. So, we cannot list out the symptoms of epileptic crisis as it is defined by the nature of the conflict and part of the brain involved and organ affected. So I can give you few examples for epileptic crisis. Brain edema in the motor cortex will lead to rhythmic convulsions, muscle cramps or spasm. Brain edema in the sensory or post-sensory cortex leads to dizzy spells, short disturbances of consciousness. If the conflict is very severe, it may lead to complete loss of consciousness also due to drop of blood sugar. Some epicrisis could be dangerous, especially when the conflict active phase was long and intense. Say for example, heart attacks and strokes. So Dr. Hamer therefore strongly advises not to take antispasmodic or sedative medication during this period in order not to interrupt this highly critical event. So sedatives administered at that point could cause a person to fall into a coma. The epileptic crisis usually occurs during periods of rest, weekends, holidays, vacations, in the early morning hours or during sleep when the organism is in deep vagotonia. Intensity of epileptic crisis is defined by the intensity of the conflict. Many of the time the healing crisis is completely harmless. So the clearing of conflicts while a person is already in healing, as it is practiced by certain alternative therapies, bears the risk of serious complications for the individual. The same holds true for psychological therapies. So Dr. Hamer says the physician has to understand the psyche, the psychologist needs to understand medicine. Next, we will be seeing about the hanging healing. So a hanging healing refers to the situation where the healing phase cannot be completed because of recurrent conflict relapses. So I have given this pictorial representation to show you what a hanging healing is. So conflict active phase or the cold phase, when the conflictolysis happens, undergoes warm phase or the healing phase. When the healing is hindered constantly, it will make the conflict hanging healing. Okay. So what makes a conflict healing a hanging healing? To know this, we must know about the tracks. During DHS, our mind is alert. Our subconscious picks up all components considered as relevant in association with the conflict situation. Even after the train left, the rail track remains. In similar way, such imprints that remain aftermath of a DHS are called as tracks. Also, the train runs on the track and the SBS runs on the tracks. So, even after the DHS is over, the SBS runs on the tracks. So, it is very important to identify the tracks and to remove them. The biological purpose of the tracks is to function as a warning signal in order to avoid experiencing the same conflict a second time. When in healing phase, tracks have the potentiality to reactivate a conflict. So when you are in a healing phase, if the tracts are encountered, it has the potentiality to reactivate your conflict again. Tracts also have to be taken into consideration while dealing with recurring conditions to avoid hanging healing and hanging conflict. So based on German new medicine, the so-called allergies are nothing but tracts. Examples for tracts are the place where the conflict took place, a person or pet that was involved, the taste of a particular food, specific sounds or noises, the weather condition, a certain scent, perfume, flowers, a certain word, a voice, a gesture, feelings such as fear, subtle tracts stored in the biological memory like fish will aggravate skin complaint, peanuts will cause stomach pain, ice creams will cause cold. Such things also become tracts. Being constantly on a conflict track causes hanging healing as well as hanging conflict. Each conflict relapse interrupts and prolongs the healing process, making them chronic or recurring conditions. This is yet another right knowledge about the disease, and it is very important to know about tracts. This knowledge about tracts helps us to rewrite our subconscious reading about the so-called allergens. Nowadays, we rarely see any acute cases in our clinics. We get lots of chronic cases only. This is the pathetic condition created by the ignorance of the biological process involved in the so-called diseases. And the vast range of mismanagement in the name of treatment hinder the healing process. Even the so-called acute cases are mismanaged and converted into chronic one. Hence, the right knowledge of GNM is imperative. So extended tracks. Extended tracks are created when a new situation is associated with a track that was established when the original first conflict occurred. Let's take an example. If a boy has a scary experience with a neighbor's dog and suffers a territorial fear conflict, putting him into an asthma constellation, provided the conflict is not resolved, he will now be allergic to that dog or any similarly looking dogs as a trigger for an asthma attack. Let's take the scenario that one day the boy is outside in the garden and is eating a peanut cookie. If he sees at this very moment the neighbor's dog, the track, the taste of the peanut is associated with the dog track and will be instantly added as an extended track, resulting in an allergy to peanuts with asthma symptoms. If on top his father is doing a paint job while he encounters a dog, the boy will from now on also be allergic to that particular chemical fume, the paint. This way, over time, more and more tracks are added to the BHS and programmed into the conflict-related brain relay. In this case, into the control center of the bronchial muscle. Because I request all the global GNM members to recollect the case presented by Dr.C.J.Varghese sir, a case of abdominal discomfort and abdominal pain, where the lady, a right-handed female, aged 38 years, when first encountered the indigestible muscle conflict, had only muscles allergy and later became allergic to all the seafoods. This is the best example for extended track. In GNM therapy, identifying the tracks and extended tracks is of utmost importance because only then the recurring allergy can be stopped. Recognizing that the conflict has been resolved and bringing into awareness that the tracks are no longer a danger and that the extended tracks are now irrelevant provides the ultimate chance to complete the healing of the chronic conditions. So in the light of significance of tracks, so-called allergens or important warning signals, GNM is able to explain why one and the same allergen, for instance milk tract, causes different symptoms in different people. So one person develops skin complaints while taking milk, one person develops abdominal complaints while taking milk. So GNM is able to explain why this is happening, because the nature of the original conflict can be assessed only by the symptoms the individual is manifesting when he is encountering the tract. So if it is a symptom that reveals the nature of the original conflict. So Dr. Hamer says if the patient has been made aware of all the facts, he will no longer need to get frightened by his symptoms. He can now fully accept these as the healing symptoms they are, all of which had until now caused fear and panic. In the greatest number of cases, the whole episode will pass without any serious complications, serious consequences. So I have given a simple example of rectal XPS. So the conflict related to rectum is shit or feces conflict, means a dirty business, malicious slander or mean accusations, shitty incidences will lead to shit or feces conflict. On the brainstem, the impact of this conflict is seen on the brainstem as ring configuration, that is called as Hamer focus, on the left side of the ring form of arrangement. So this is a endoderm derived tissue. So during conflict active phase, cell proliferation takes place. As already we saw, conflict active phase is not very much pronounced or very much visible to the person. So the cell proliferation is not very much seen. So repeated conflict activity or hanging conflict or hanging healing leads to repeated cell proliferations, and this proliferation is diagnosed in conventional medicine as colorectal cancer or rectal polyp or flat cauliflower growths in sigmoid colon or rectum. So during healing phase, rectal bleeding, tarry bowel movements with microbial activity, night spells, rectal abscesses, rectal cramps, rectal spasms are manifested on the individual. So this is a simple example I have given to understand what is a conflict active phase, what is a healing phase, and what is the conflict theme related to the rectum. So natural healing is gifted to all living beings, and it is a biological wisdom gifted to all the living beings. Who heals your disease now? It is the patient, that is the individual himself. I dress the wound, God heals. It is a godliness in every living organism that heals the organism. It is not the medicine or it is not the doctor. So I fear the day that technology will surpass our human interaction. The world will have a generation of idiots, says Albert Einstein. Have you seen birds flying back to home in the evening? They don't wear any watch or smart watch with them. They don't have a cell phone to show them the time. They are ignorant of the time zones even. Because they are gifted by nature with biological wisdom, they are not dependent on artificial intelligence. This is not only applicable to birds, this is applicable to every living organism in this planet. So it is high time to respect our internal doctor. Let us cultivate the habit of respecting our internal doctor. So now it is left to one's own discretion to decide whether to follow the myths or to follow the facts given by German New Medicine knowledge. So a quick recap of what we have learned today. Names of the diseases must not scare you anymore. Let's define which organ or tissue is involved. Let's define whether cell proliferation or cell loss or inflammation or scarring or edema or functional loss is presented on the physical level. Let's define the conflict theme. Now we have to analyze whether we are in the conflict active phase or in the healing phase. And we have to see whether healing is completed or it is hindered, leading to hanging healing and hanging conflict. So what to do when we are in a conflict active phase? Identify the conflict, finding ways for conflictolysis and allow the healing to occur naturally. So conflictolysis, practical solutions for real conflicts, resolving the conflict, downgrading the conflict, or we should not touch the conflict. We have to decide. So this conflictolysis leads automatically to healing phase. So healing phase, when we are in healing phase, we have to allow and accept the healing symptoms, avoid hindering the healing, do's and don'ts of epileptic crisis, identify the tracks and extended tracks and remove them from the subconscious mind. So I prepared this slide. So let's take a pledge on this first ever monumental World GNM Day celebration. Like the psyche, the brain and the body, let us all work as a one unified unit to bring the scientificity and truth in the discoveries of Dr. Hamer to light in order to make the earth a better place to live with knowledge of disease and freedom from the fear of disease. Each one, teach one. Spreading GNM is our social responsibility and it is the greatest gift we can give to our dear and near ones, and this is the highest health insurance at lowest budget investment. Thank you everybody for the patient listening. Hope you all enjoyed the session. Thank you.